Next up, we have a session that's looking deeply at financial health. We have an expert, Jennifer Tescher, President and CEO from Financial Health Network. They started looking at financial well-being first, and now they're looking at financial health as well, and in the bridge between the two. So I know that you're going to enjoy the comments from Jennifer. Jennifer, are you here? Can you click the blue button and so you can join me up on stage here?
So thank you so much for having me here today to talk about the intersection between physical and mental health on the one hand and financial health on the other. I'm Jennifer Tescher. I'm the founder and CEO of the Financial Health Network. And we have been focused on this idea of financial health for a very long time, for about the last 8 to 10 years. And if there was anything that helped to convince me that the world is deeply interconnected and everything is interconnected, it was the pandemic. And so when we saw people lose their jobs and then not have health care, as an example, or we saw the impact of getting sick on the ability to go to work. These aren't novel ideas or issues, but we all of a sudden saw them at scale. And it made us double down on exploring the intersections between physical and financial health. So here's how we think about the intersection between those two things. We think about certainly healthcare and health status contributes to your well-being, and financial health contributes to your well-being, but certainly there is a significant bidirectional connection between financial and physical health. And we're spending a lot of time thinking about how financial health impacts one's health status, and on the other hand, how healthcare in and of itself is disrupting people's financial health. So I'm going to break those connections down for you here. So when we think about how financial health impacts physical and mental health, all of our data shows that the stress of managing one's finances or of living on the edge really leads to poor physical health outcomes. We all know the impacts of toxic stress, and we think that's a huge issue. For instance, in our data, 43% of Americans say that their finances cause them moderate to high stress. An even bigger percentage of them believe that that financial stress affects their physical health. And even greater percentage believe that the financial stress is impacting their mental health. And we've certainly seen all of that over this last year of the pandemic. And as we would expect, not having health insurance because you can't afford it also is associated with higher rates of skipping a doctor visit or not taking the medication you need. Likewise, in the other direction, physical and mental health challenges reduce people's ability to be financially healthy, to have a day-to-day system that enables them to build resilience and to thrive. And in particular, we think about the medical debt that people incur, either because they're uninsured or underinsured, or just because of the way plans are designed today. They often require tremendous out-of-pocket expense, upfront expense. So our data shows that 32% of American workers have some type of medical debt. And that debt is often never going to be repaid, as we know medical debt is the largest cause of bankruptcy in this country. And from data, those bills that people have, those debts are really significant. A third of them are over $5,000. And a not insignificant percentage of folks have over $10,000. You know, we've really seen that expenses are burdening lower and middle income, commercially and privately insured individuals because they're underinsured or their plans aren't appropriately covering these expenses. And so we're really particularly interested in eligibility measurement, issues around medical debt, allocating charity, price transparency, and patient decision-making. These are all issues that go into how people wind up in debt from medical challenges. I want to spend the rest of my time talking about what we can do about that as healthcare designers, because there are many things we can do. And, you know, the first is to recognize that even though we're in the business of health care, of treating people's physical and mental health and of keeping them healthy, if we don't address their financial health, we're not going to be successful in that ultimate goal. So, you know, a hospital, a doctor, an insurer is actually in the financial health business as well. And that really relates to the need for enhancing the education for clinicians to really broaden the identification of and appreciation for the vulnerability of some of their patients from a financial health perspective. I'm going to talk a little bit about some of the interventions that we're really excited about and that we're actually starting to see some innovators really put into the market. So the first is improving access to information and transparency of medical expenses and patient optionality. This is really in the vein of patient financial navigation. So we're going to be working with an initiative that's sponsored by the Robert Wood Johnson Foundation to explore the relationship between health and financial health for commercially insured patients, and really this whole issue of revenue cycle management. We want to be able to develop a guide for healthcare stakeholders to reduce the negative impact of medical costs. So for instance, when someone takes on a bunch of debt and then only later does the healthcare provider or the hospital say, oh, that qualifies for charity care. Why can't we make that determination at the front end? That's a classic design problem that we think can be solved. We're excited to tackle that. The second is the idea of evolving the way in which we measure the financial health of patients. It's not enough to understand their physical health. We've got to be asking them and understanding their financial health so that, for instance, when someone walks out of the doctor's office with a prescription for medicine, the doctor should know in advance whether that person can even afford that prescription in the first place. So I'm really excited about some work that ProMedica is doing in a partnership with Local Initiative Support Corporation, which is a national community development financial institution. They've partnered to improve health outcomes in Toledo by increasing neighborhood resident access to employment opportunities, to affordable and healthy food, medical care, income supports, savings. As part of the program, residents have access to a financial opportunity center where they can get financial counseling. And as a result, people have increased their income, they've improved their credit scores, and ProMedica is now reporting that the initiative is beginning to yield promising results on health utilization and on cost. The third possible intervention is around helping to reduce the impact of medical debt assignment. There's two interesting things going on here that we're watching. One is an organization called RIP Medical Debt, which uses donor funds to purchase and forgive individual borrowers' medical debt. And once the debt's been forgiven, they help recipients repair their credit reports. I think their work is fantastic. I also think there's really more systemic things that we need to focus on, so we don't get to the point of someone being so indebted that we need to essentially buy and forgive their debt. Another organization doing great work is one of our organizations, portfolio companies called MedPut. They offer an employee benefit program that provides 0% financing and bill negotiation services for out-of-pocket medical costs. Repayments are then made through payroll deductions. And the goal is that by reducing employees taking out 401k loans or racking up lots of medical debt or turning to other kinds of predatory credit, they can create a healthier workforce with no financial risk to the employer. We're really excited about some of the work they're doing and what they're learning. Then there's this issue of optimizing healthcare benefit provisions and utilization. What actually is in the package of benefits and how can we increase their usage? We're doing some work with Humana and they recently conducted some consumer research to determine what their members needed as it related to financial health. And they tested a series of concepts with their members to determine which of those concepts would actually best meet some of the needs as a way to expand benefit offerings beyond just paying for healthcare, but to other kinds of financial health sorts of issues that people have. I talked about education. And the last one is enhancing integration to inform financial health and health delivery decisions. And here, I think Banner Health is a really interesting example of a hospital system that's developed a sophisticated care management integration. So they have a new data platform that unifies patient data across multiple systems and has simplified workflows across teams and is supporting its population health management strategy. Ultimately, we need to give clinicians and administrators a 360-degree view of the state of their patients, their members, their insured populations, so that we can understand and see both their physical and mental health status and outcomes, and also their financial health status and outcomes, frankly, on the same screen, so we can start to understand more deeply the interconnections. So with that, I would just encourage all of you to see yourselves not just as healthcare professionals, healthcare designers, but to also see yourselves as financial health practitioners as well. Because the more we can bring these two concepts and issues together, the more likely we're going to end up with the ultimate outcome that we want, which is a healthier population and healthier individuals. Thank you.
Thank you, Jennifer. That was fantastic. And I'm so encouraged to see all the innovation that's going on. Thank you for sharing that with us and for pushing that forward with many players. You know, it's so interesting because, you know, there's health literacy and there's financial literacy, and then there's health insurance literacy, and there's sort of literacy in the overlap. And you have the government, you have employers, you have individuals, you have pharmaceutical companies with, you know, drug affordability programs, you have hospitals and medical bills, and you have support programs there. So you have all of these various players, and you have, you know, people in the middle trying to figure it out. And it seems like there's awesome pockets of innovation going on, like whether it's benefits innovation or employers, you know, wanting to know, is somebody experiencing medical debt or on the verge of bankruptcy, and how might we support that employee? And so there's all these interesting things happening, but where are you seeing the most encouraging collaboration between parties to really kind of invent a new way of being? Because this mess is the result of how the data and the money flows, right? So are you seeing any really like promising bridges being built?
Not exactly, but I don't think it's because they don't want to be built. I think it's because, you know, we're in the middle of a pandemic, and you know, folks have got their hands full. I think one of the best examples that I've seen is really the Root Cause Coalition, right? That brought together hospital systems and insurers and others really around the issue of so social determinants of health. And in particular, they started with hunger. Mm-hmm. And I think as the industry becomes increasingly sophisticated about the social determinants of health, mm-hmm. and they're going to recognize that it's not enough to do stuff around the social determinants in the community. You have to bring it into the business, into the way your own business is conducted. It's not like someone else's problem. Like we're going to find a community partner and they're going to take care of it. We do need partnerships. And I've seen there's lots of great partnerships going on. And I think that's the beginning of it. But you're right. We need an ecosystem. Now, listen, even in health, there's all kinds of navigation issues that are challenging in healthcare, right? This is just yet another one. But I'm hopeful that healthcare providers will understand that this is so deeply in their best interest. Mm-hmm. Because at the end of the day, this is how they're going to get paid. And this is how they're going to be successful in ending up with healthy patients, right? If you're treating chronic diabetes patients, right, or folks with other kinds of conditions, and they can't afford the medication or don't have healthy food to eat, like you're never going to succeed in the ultimate outcome of a healthy patient.
Yeah, it's so important what you're talking about. Mary Blackford was shining a light on that this morning, talking about food apartheid and how we can provide, make sure that people have access to healthy food. But it's like when we're talking about financial health and financial well-being and the relationship to health, we're often looking at consuming healthcare and when you get the bill and how you're going to afford it and all the resulting problems that happen. And we're not often looking at exactly what you just said, which is prevention and setting people up for success and realizing that, there's this healthy, wealthy paradigm where, the folks who have time and have money are focusing on, being their best selves, but everybody else is not sort of having those opportunities. And so the overlap of prevention and financial well-being, I think we're going to see more, I hope, innovation in the years to come. And also, continue to be amazed when you go to the dentist, when you go to the vet, take your pet to the vet. They do a great job at setting expectations around how much things are going to cost. So it continues to amaze me. But we are behind, but so many encouraging things are happening, and hopefully post-pandemic, we'll push those things even further forward, thanks to good work from folks like you. So thank you for the work you do and Financial Health Network. I can't say more good things about you all, and you have a conference too with a lot of great information. So we'll look forward to that. Thank you, Jennifer.